Thank you. I've asked my technical assistant, Brian, to point the live stream at the PowerPoint at the screen, because I do have some videos that I want to show you as part of my presentation, and I think it'll be more valuable for the folks who are watching from home. So good afternoon. It's really an amazing experience to be together with all of you today. It really adds validation to the idea that we're not alone. I have my Kleenex because I lose composure, which I've been known to do when I talk about KLS. I thank you for being here, all of you. Public speaking is not really one of my strong points, but I'm very driven to share whatever I can to help somebody else the way that I was helped when we were in the thick of our journey. And I hope that I will help some of you today with this information. I'm not any kind of expert on KLS, but I am a nurse, so sometimes I understand a little of the medical needs better than lay people. And most importantly, I'm the mother of a person with KLS. And my intention today is to leave you with some information and some tools, and most of all, hope. For those of you who do not know who I am Brian Sable's mom. This is Brian Sable. So our KLS journey began back in 2006 when Brian was 14 and in 8th grade. He got a really bad flu bug and just got sicker and sicker and sleepier with each passing day. He ended up in the hospital for about a week, and it was kind of like a scene from that TV show House. We had interns and residents coming in and out of the room, and everybody wanted to crack the code of what was wrong with Brian. And then after all the tests came back negative and inconclusive, he just spontaneously got well, and we took him home and never really knew what had happened, and we were just going to go on with our lives. Then about 2 weeks later, he was well one minute and sick the next, and that was his second KLSF episode. So I panicked and I called the pediatrician, who said, well, we're not be in the ER. And I said, well, that's great, but what are we going to do for him in the ER that you haven't already done? So we agreed that we would tough it out over the weekend. I don't know why these things always happen on Friday night. We would tough it out at home over the weekend and we'd meet him in his office Monday morning. Well, it was that weekend that I Googled 3 things: adolescent, confusion, and hypersomnia. And boom, I got over 20 hits for KLS. As I read, I was convinced that this was exactly what Brian had. He had a textbook case, actually, of Kleine-Levin syndrome. I owe a tremendous debt of gratitude to the foundation. Really to all the people who helped make the information available to me, because it helped us to get a very rapid diagnosis for Brian so that we could provide the supportive care that he needed. Brian is now 22. His last deep episode was 4 years ago. And we have hope that the worst of the KLS journey is behind us. Although we're ever vigilant that one of the lighter episodes that have occurred as recently as 8 months ago might turn into something more. We know from others in our community that a deep episode can occur after long stretches of wellness. So, enough about us. I want to share with you today some information that I hope you'll find useful. What I plan to cover is some information about our healthcare system, how it has changed and is changing, and why that's really good news for KLS patients and families. How to ensure that you have a great patient experience, and I'm going to go into some definition about what the patient experience is. Tips on finding a doctor that you can work with, key phrase there, that you can work with. The ABCs of supportive care, and then hopefully we'll have time for discussion and questions. So by now you're probably all thinking, oh my God, not another PowerPoint. I'm going to try to add some levity here and there and keep things moving. So we know that KLS is unique and rare, and yet we all share the universal experience of being healthcare consumers. I'm sure you've heard about how doctors are getting paid less, and meantime, our fees of consumers go up and up. There's a lot of evidence that in choosing a physician, patients value concern and connection as much, or maybe even more, than technical competence. The perfect world is someone like Dr. Rye, who is both caring and clinically excellent. We have Google, we have Yelp, we have Wiki. Patients have become much more savvy, and they judge healthcare and rate healthcare, not just on the clinical outcomes, but also on the compassion and the patient-centered care. So what's really interesting about this, that as a result, the patient experience has emerged as the key differentiator when we're choosing a physician. So why does the patient experience matter? Because being a patient is very personal, it's very stressful, and if there isn't empathy, then we're just a chart, or just a 10-minute second of time that the doctor has to get through. And what we really need is to be seen as a human being who has needs, who has fears, who has concerns. So I want to take a few minutes and show you a short video that's put out by the advisory board, and it explains the importance of the patient experience. My technical
Why should I care about patient experience? That's a question we often hear from physicians, and for good reason. Many providers fear that improving patient experience means doing whatever it takes to make patients happy, even if what makes them happy isn't what's clinically best for them. As one physician put it, we are not in the business of doing the nice thing. We're in the business of doing the right thing. But what if the nice thing and the right thing were actually the same thing? That's how the strongest performers on patient experience see it. For them, good patient experience is about following the golden rule. It's about ensuring that all patients are treated the way we would treat a friend or family member. And that kind of care can pay off in many ways. For starters, there's the pure financial impact. Medicare and a number of commercial payers are starting to tie provider pay to patient experience service scores. Physicians whose patients report a better experience are also less likely to be sued for malpractice. But that's not the only reason we care. Far more important is the experience has a direct impact on how likely a patient is to choose and remain loyal to a particular provider. As providers, we might like to think that quality matters more, but what really turns the dial for patients are things like communication, service, and access. And with the rise of online physician ratings, it's not just their own experience that matters. In a recent study of 2,000 patients, nearly 70% said they look at online reviews in deciding where to seek care. And more than a third of those had chosen to avoid a physician based on what they read. Finally, we can't forget the link between patient experience and quality. Studies indicate that patients who have a better experience with their provider are more likely to follow care instructions. And providers who take the time to listen to their patients are more likely to develop care plans that patients will follow. In one analysis, simply improving provider communication skills had an impact on chronic disease outcomes that was comparable to that of common clinical treatments like statin drugs. Small, but significant, and without the negative side effects. So improving patient experience isn't about treating patients with kid gloves or deferring to their every whim. It is about understanding what's important to patients and doing our best to incorporate that into how we treat them. Those who can get that right have a lot to gain.
Yay, thanks. So, empathy and connection. These are things that are actually being taught to physicians and staff people all over the country. And you might ask yourself why. In the last few years, this has become actually tied to reimbursement. And so these, a whole industry has now emerged of companies that go out and train providers on how to incorporate empathy and caring into their interactions with patients. Raise your hand if you've ever used Yelp to look up a doctor that you see. A couple. It's matter. Raise your hand if you've ever received a survey in the mail after going to the hospital or to the doctor to rate your experience. Oh, a lot of you. Okay, that's good. So let's talk about those surveys for a minute. Those are called CAPS. And what are CAPS? It stands for Consumer Assessment of Healthcare Providers and Systems. And if you receive one of these surveys, please fill it out and please let your voice be heard. This is actually shaping the future of our healthcare system. Your comments are very important. They are actually tied to reimbursement for the hospital and for the doctors. Right now it's about 1 to 2%, but it will probably increase as time goes on. It's really important that we understand this as KLS patients looking for help, because we have rights now with this movement that we didn't have before. Rights to be heard, to be understood, and to really get our needs met. And we need to leverage that to our benefit. I do have one other video that I want to show you. This one's put up by Cleveland Clinic. Somebody mentioned that they went to Cleveland Clinic. Right. Cleveland Clinic is actually a national leader in this movement. And they put this video out, and this has become the video that's used ubiquitously all over the country. And it's about 4 minutes long, and it's really moving. And what it's showing you is what's going on in people's minds and hearts. And it challenges you, you'll see when you get through it, to think outside of yourself, that when we go in as a patient, it's not just our needs. Everybody's got something going on in their minds and their heart. And the more that we can be empathetic to each other, the better these interactions we have. It's all about building a relationship with your providers, and everybody has something going on. So I'm going to have my technical partner.
Are you seeing the doctors and people too?
I am. So that's the message that is being spread throughout the country to our healthcare providers. And I don't know about you, but this is really inspiring for me. And I think it's great news for us as a KLS community that we can expect a greater level, we can demand a greater level of compassion and understanding for what we're going through and what we need help with from our providers. By the way, I want to mention this, one of the metrics that are measured for doctors' offices is how well they collaborate with other providers, other specialists on your care. And this is huge for us, for the KLS community as well. But that's actually part of what they get graded on is, are they helping to collaborate with, with the sleep specialist, with the neurologist? Is the pediatrician able to get a hold of the neurologist? All these kind of things, which I found some of that really frustrating when I was on the journey. The patient-centered care is replacing a historic physician-centered system, and now it's going to revolve around the patient. And our need for supportive care aligns with this new focus really well. The patient of the past believed the doctors were all-knowing experts, was passive, and didn't ask questions. We didn't know that we had rights. But along with rights come responsibilities. Remember that old saying, if you want to have a good friend, you need to be a good friend. Well, if you want to have a great patient experience, you have to be a great patient. So, I want you to think about what it is that you want from a visit before you go. Predetermine your visit goals. Is it a diagnosis? Is it assistance with symptom management? Is it documentation for school or work? You've got to be a partner with your doctor to manage the care. I know I was talking with Dr. Rye's wife earlier, and I asked her, if I lived in a remote area and I wanted Dr. Rye to work with my doctor on, let's say I want to go on lithium, and my doctor wasn't sure of the dosage. How would I get Dr. Rye in touch with this doctor? She said, that's a great question. I think we should ask him. I think he's coming later and we can ask him. But how do we partner together in the medical community? How do we as family members and patients facilitate that happening? And I know that many of us, I've got another slide coming up where I talk about how we have to educate the medical providers that we have in our community, and it's really important. And how do we do that? And also really important to question anything that does not seem safe or appropriate. Sometimes you have to point the obvious out to the doctor. So if you want to go take it from good to great and just be an absolutely great patient, you've got to realize the time is limited that you have with the doctor. They would love to spend an hour with each of us, I'm sure, but they do have very limited time to spend with each patient. So you want to make the most of that. You should really fill out your paperwork ahead of time if that's possible. Have your list of medications with the dosages and what time of day you take them. Now, sending reading material to your doctor, you can send them links from our website, or how about you put the reading material you want your doctor to have on a thumb drive and drop it off at their office with a plate of cookies. A lot more likely they're going to sit down at the computer and put that thumb drive in and actually look at the material. So it's things like that that elevate you from good to great on the patient scale, where you're really going to show that you're going to be a great partner with that doctor. If you have labs or imaging results, bring them with you. I know I had a stack of things that I carried with me to doctor's appointments, consultations that we needed to have. I had copies of all that. And, good idea to be there on time or early if you can do that. Here's a really important thing. Be courteous to the staff. You know, just reflecting on that video we watched in Cleveland Clinic, they have a lot on their plate too. It's really stressful. And if you're courteous, you're going to, what's that saying? Get a lot more bees with honey, flies with honey, something like that. So how about finding a doctor? Raise your hand if you are in the process of finding a provider right now, or switching providers. Only a couple of you. So most of you have somebody that you're already working with. So I just wanted to go over the do's and don'ts. And some of this is probably obvious. We do have a list on our website, on the Foundation website, of physicians, and they're listed by state. So these are providers who Lori, Haller, and I have contacted personally, and they have agreed to be on our website and agreed to see other KLS patients. Another thing you can do is network with others in the KLS community and find out what success stories they've had. You can utilize search engines like healthgrades.com and ratemds.com. You can check with your insurance company. Lastly, you can screen potentials on Yelp. How about the don'ts? Well, obviously, don't just pick somebody randomly. I think it's important not to expect people to know, providers to know about KLS. If you are seeing a doctor who's unwilling to learn about KLS or a rare disorder, how do one think about changing? And please don't think you have to stay with a doctor who's not collaborating with you, even though you've made a really good effort. How about your role as a KLS educator? We have a lot of reference material available on our website. The KLS Foundation, YouTube, amazing resource. Tons of material there. And Facebook. I want to talk about YouTube for a few minutes. There are some very courageous people, a couple of them are here today, who have been willing to post video footage of themselves in episodes. And a video is worth 1,000 words. And I have found it very, very useful when I'm educating others, expanding consciousness of people in my sphere, to share some of these images, some of these videos with them, because you can explain it and they can read articles, but seeing someone in an episode is a whole other experience, and they instantly get it. So this is a photo of Mr. Matt Sherman. Matt, you want to stand up and take it out? And I hope I got this right. His series is called My Life with KLS. Okay. Amazing, great. If you have not checked this out, I strongly recommend that you do so and share it with others. And who are these lovely ladies? This is Alana Wong, our own Alana Wong. Alana, take it out. Tanis Burnett. And this is a picture of them at the 2011 conference. Alana has numerous posts on YouTube. She's been on several TV shows. She has a website called Alana Wong Life. Is that right? Did I get that right? Okay. And she, like Mr. Sherman, has been very brave in posting and sharing video footage of herself in an episode that's really very educational for providers to see. Tanis cannot be with us today. Unfortunately, she is in an episode. She is ill, and she is missed. And we wish her well. We wish her speedy recovery. So I want to talk about the ABCs of supportive care. Often, the right supportive care is the best thing that we can do. And providing a safe and caring environment until our loved ones return to us in mind, body, and spirit. You might want to work with your doctor to try some meds, and Dr. Arnold has presented some options to us today. I think that it's important for us to explore, anything that we think offers hope. And we do have this whiteboard to my right here, and we talked about maybe after we finish this particular segment, and maybe we would have people share what they are currently trying or have tried, what's worked, what hasn't worked, and we could maybe write that down and put that on the website for people. It's something that has been asked, I think, multiple times over the years is, how do you access the information, at a grassroots level of what have people tried that's worked and what hasn't, so you can make a better decision about whether you want to try something. This is a quote from Matt Sherman again. Sorry, I keep picking on you. This is from one of his video posts. If you want results you've never had before, you have to be willing to do something you've never done before. So scary as it may be to try a new medication, it does offer the hope of a result. I want to talk about KLS Revealed. KLS Revealed is a guidebook that was authored by Alana and Diane Wong. It's sort of like a survival guide for the person with KLS, the family of the person with KLS. It's an amazing, amazing read. It's a must read for anybody who's touched by KLS. It's got a wealth of information. Some of the highlights are caregiver strategies, coping mechanisms, how does one heal, what you can do to help, explaining KLS to others, and finding emotional support. Tips from the collective wisdom and collective experience, which I think are captured in KLS Revealed, is to create a physical environment that's safe, secure, and comforting. Try to decrease noise and light. Allow the person with KLS to sleep as much as they need to, and offer healthy foods when awake. Now, cookie dough, in and out, macaroni and cheese, count. Need to be patient, calm, loving, and a good listener, although many times a person in a KLS episode isn't doing much talking, but when they start to come out of the episode, there's a lot of talking, right? Consider limiting visitors. I know that we did this with Brian because sometimes he would say and do embarrassing things, and it was part of protecting his dignity to limit visitors, so that no matter what he would say or do, wasn't going to be ridiculed at school later for that. Taking custody of cell phone, computer, and car keys. I do have a story about this. During one episode, unbeknownst to us, Brian had called our neighbor that we carpooled with, who was a beautiful girl, and professed his undying love and proposed marriage. And I got a call from the mom and dad who did not know that he had KLS or what KLS was, and kind of saying, "Is your son high? What is going on?" And of course, he was mortified when he came out of the episode and realized that he had done this. So, again, to protect the dignity of this person, good idea to take the cell phone. If your person with KLS is over 18 or approaching 18, you might want to think about a durable power of attorney, because with the HIPAA laws and privacy concerns, you might be in a compromised position to help your person with KLS unless you have the right paperwork for this. KLS Revealed is available for download, and net profits go to the KLS Foundation. I strongly urge you to make arrangements to get this for yourself. I have given you one tiny grain of sand in a vast beach of information from this guidebook, and I know that Alana and Diane will be happy to help you to secure that for yourself. I put the website or the link to how you can purchase it online if you'd like to, but you can also just contact them directly. And I want to leave you with one last nugget, and it's about hope. And this is a quote from KLS Revealed. There's some absolutely beautiful words and sentiments expressed in this book that they've written. This one really resonated with me. I'm going to read it just because the people who are streaming from home will be able to see it. I hope I can do it without crying, but so far I haven't been able to. But here we go. Hope is the belief that our children will find the meaning and purpose in their lives, and through the adversity of their suffering, the greatest opportunities will be revealed. Thank you.
Questions?
Actually, I don't have a question. I have a comment, and thank you for being here. I just want to advocate for a neurologist that I share with another mother here in the Boston Children's Hospital. I cannot tell you, I've had one other surgeon directly emails me documents that I need, and the communication and the questions. She's right there by email. I mean, I've never had a medical experience. So this doctor, if it was in the Boston area, she's proximate, and I think she had the demographic of 5, Dr. Kieran Maskey, M-A-S-K-I. Again, accessibility to medical information and questions. She is extremely responsive from the Harvard Medical School, Boston Children's Hospital.
Is she on our website?
I don't know. But Dr. Scammell, Dr. Thomas Scammell, who is on the website, is who we heard. He saw my daughter first at the sleep study, and colleague with Dr. Kieran Maskey, who's in the pediatric, he's been working with adult sleep disorders.
I would ask that anybody who has a recommendation of a doctor in their area that they're working with, that they think would be good for other people, you know, you're having a positive experience working with this provider, please let us know so that we can contact them and ask them if they'd be willing to be listed on our website. We have to ask them first. And then we will gladly add them, and you'll really be helping somebody else if you do that. So please share that information when you can.
Do we have any feel for the doctors that are listed on the website? They're mostly neurologists or sleep disorder doctors. What kind of doctors typically are KLS doctors?
That's a really good question. It's a smattering. There are a lot of pediatric neurologists, some pediatricians, some sleep disorder specialists. There are a couple of psychologists, one psychologist. In my case, we worked very well with our pediatrician. We grew up together learning about KLS. And he turned out to be such an amazing collaborative partner with us. We actually went and presented at grand rounds for the neuropsychiatry department at the Children's Hospital in our city together. And that was just such an empowering experience too. And I think Debbie, we talked earlier on one of the breaks about the need to go out and actually educate our children's hospital departments, the neuropsychiatry departments, so that they know what KLS is and how to spot it. You know, it is so rare, but maybe we plant the seed. When they do have a patient that presents, they'll think about it and go, oh, I wonder if I should rule that out. So, I guess the Reader's Digest answer is there's all kinds of doctors on there.
So Gaylene, I have a question, and I may answer part of it myself, but I think what I heard is that it's not really important. It's way far down the list that your doctor has actually seen a KLS case. Yeah.
That's correct. I think it's more important that they be willing to learn about it and willing to collaborate with another doctor who is more of an expert on KLS. If you're looking for symptom management, if you want to have something prescribed, that they may have to consult with someone else, but it's really someone that's going to work with you, be empathetic, listen to you, meet your needs. And there's plenty of information, be it articles, medicalese articles that we have on our website that you can access, or these great YouTube videos that are available. You can teach them up. It's the attitude.
Right. Yeah, and is there another question? I guess along that point, and I can't even recall how we found my doctor, but when I was having episodes, the doctor I went to, he was effectively a heart specialist, looking at my parents. I would go to his office and I would sit there, and there was a bunch of old people there when I was young, right? Gray hair, and wheezing, and having trouble. I mean, that was his primary practice, but he was really interested in kind of sleep disorders, and so he saw, I have this side, group of patients that he saw, he was willing to review stuff, and probably more importantly, I liked him, so, I would go and talk to him, and, he was very supportive. Anytime there was a new medication that was out there, so I started with Tegretol. I was on lithium for a few years, Antidine. When I got sick for my senior ball, he gave us a prescription for some kind of amphetamine that I actually didn't take. But as long as it wasn't something that was going to injure me, it worked out. By the way, Brian, I during that senior ball day told my date that she was perfect, and I would definitely be marrying her one day. And he did. Yeah. It was 19 years next month, so it's a
My pediatrician has a question, or my neurologist has a question. She says, do we know who to refer her to get more information? My son is the only KLS patient she's seen. She doesn't know where to go to get that information, medically speaking. Do you guys have a reference as far as that's concerned?
That's a great question, and I think you could look on the website, because you can feel assured that any of the doctors listed on the website have worked with a KLS patient, and they've given permission to be listed on our website as a resource. So that's a great place to start. Here we have the great Dr. Rye. Let's give a round of applause. And so Dr. Rye, help us answer this question from the audience. The question is, you live in a rural area, you have a physician that you're working with to manage your symptoms and your care, and that physician would like to collaborate with another physician who's more experienced with KLS. What's the best way to go about that?
Is this on? Yeah. Well, I don't know if we have a right answer, right? I mean, this is such a rare, uncommon disorder that, it relies a lot on ownership and interest on both parties, as well as certainly the patient and the patient's family, most importantly. So what we've done here is, I don't know if I'm different or special, but most of my KLS patients have my phone number or my email address, which is, I'm not inviting everybody here to do that. so when spells happen or things happen, we communicate. There's probably several people that you and I can speak to that. And then I develop a relationship as appropriate with a local physician that's appropriate. If they're close enough, I mean, Georgia is a big state, and some people don't live right in Atlanta, but I try to get them to be seen by myself, or otherwise, I don't know what rural means. I mean, it's, sort of in the eye of the beholder, right? I mean, Iceland is rural. But there's lots of electronic ways to communicate now, right? I mean, most universities are able to hit compliance with those sorts of communications, either through patient portals or other electronic media now. So those communications can be actually kept track of actually by at least the academic center that, like ours does. Because so if you communicate with me through a certain venue, that's all becomes part of the patient record. And then to some extent, that third party, which might be a local physician, is kind of not in the loop. But I don't know if every academic center is moving that way, I think, you know, including ours. For sure. I don't know if that's very helpful.
That was helpful. It gave us hope. Nothing else. And Erin is right there, and I think she wants to say
the same way we advocate with our children with their schools and everything else, you have to advocate equally as hard, if not harder, with the doctors. I know that sometimes just to be a little bit of a test and send emails and phone calls, and it doesn't always come naturally to all of us, but once you get going and you get success, you feel more confident and continue to do so. I find when I try and get someone invested in Connor's story, if I send an email, or I always do an email or a letter, I will always attach a picture of Connor to the email. Because you then have to look at him, you have to read the horror we've been through, and then choose to say yes or no. And I think putting a picture with that letter helped.
And you tell me if I'm right or wrong, and then it goes the other way.
Yeah.
Follow. I mean, if the doctors can invest that interest, and you want to engage them, you know, the worst thing that really aggravates me is when I don't get follow-up patients, and then I don't know because that's information to me for the next person that contacts me. Did I do the right thing? Did I do the wrong thing? Am I really stupid? Or did I do the right thing, right? But if I don't have a data point, because somebody used me, quote unquote, right, for their purposes, not giving me feedback within reason. But some people, in fact, don't give any feedback, and I'm going to assume, oh, they're in their results. What did I learn? As a physician anymore, right? Because then I need to use that experience for the next patient. But if I don't get feedback, I don't have a data point. I have a data point.
And just another point, if you have a doctor that you're working with that you really like, which I did in Boston, I had a doctor we really, really liked, but then there were new things coming up the pipeline that this doctor just wasn't comfortable with trying. Well, sometimes you have to cut the tie with somebody that you've been attached with and involved with for a long, long time, and you find somebody so much better. I know that my family couldn't be any more grateful to Dr. I for taking Connor on as a patient. And, you know, we've made the commitment that, you know, we will continue to travel from Boston to Atlanta, and Dr. I stuck with us, and I tell him, I don't care if you call Connor's case KLS still, or you change his diagnosis to idiopathic hypersomnia, call it whatever you need to, just fix it. And I think that's all that matters to any of us, just fix it and make it better and give us our kids back. Dr. I couldn't do that.
Yeah, no pressure.
Other questions? Other questions? Did you have a question? Okay.
My son is 15. He was just diagnosed. He was just diagnosed July 8th with KLS. He had a football injury. Nobody in Birmingham knows what to do. I sent my information to Dr. Rock. Nobody in Birmingham wanted me to go anywhere or look on the internet for anything. And I did, and I found KLS. It has helped me a lot because I didn't know what was wrong. He was sleeping 22 hours a day. My son would have gave me before this to shut off his back. Now he is fighting everything. Took 5 nurses to hold him down to the IV in the hospital because they thought he was going to hurt him. But he feels like he's in left field by himself. Nobody wants him around. He cuts his knee out from one end to the other. And when he come home from football practice, he's just the manager for the team, but they still want him to be part. And he sat in the truck with my boyfriend and said, please help me. There's something wrong. What do you do with your mother besides take you to the learning experience? And in Birmingham, he had been in there in September for 42 days, and they didn't know what was wrong. They just said, can you take him home and take care of him? And then this next episode, this is 4 episodes now, and we got one neurologist in Birmingham that found out and said, hey, he's got KLS on the second day. And he's home right now. He was going to come with us, but he's having an episode where he can't do anything. And he can't go to school. And all his friends are going, what's wrong with him? What do you sit there and tell him? Because he can't wake up. So none of them knew anything to do with him. And we prayed and talked and sat down and held him and said, hey, something's going to be okay. And maybe with Dylan being strong, maybe everything, I don't know what to say, but thank you, KLS, for being there.
What is your name?
My name is Teresa.
Teresa, thank you for sharing that. I would like to say that there is an enormous amount of emotional support that is available to you and your family through the KLS community. It is a warm, loving, helping community. So please reach out. Facebook, Lana, do you have any other suggestions where she could go for that kind of emotional support?
Definitely Facebook. And you can reach out to any of the board members on the KLS Foundation. We all have emails on the KLS Foundation website listed, so you can reach out to any of us and we'd be willing to talk and chat.
Yeah, I think I suggest is in dealing with especially schools and other organizations where you don't want to go through, the brochure is a wonderful way to give a lot of information to people in a very short period of time, to be able to get them to understand, yes, this is something that they have, it's very unique, you may not have ever heard before, but it's real. And once you get over that hump of that, this is real, then the help comes easier and the understanding comes way easier. So absolutely use the resources associated with that.
I give you a lot of credit for coming today because you're still in the beginning phase that's so painful. And we all feel for you.
Okay, let's have Dr. Rice speak.
Okay, Dr. Ryan?